Well, now we have the legal part of the issue settled. However, if 20% of students are using these drugs, we know that 20% aren't going to jail. So legal penalties might not be very imminent for most. So let's take a look at another question. Not is it legal, but is it prudent to be using these drugs? Martha Farah, who's a professor of psychiatry and the director of the Center for Neuroscience and Society at University of Pennsylvania, gives three areas that we should consider when making decisions about how to use these drugs. The first is biology, the second is justice, and the third is philosophy. Beyond the biological effects that these drugs have on us, there is also a social effect that it has on people around us, particularly those who are in the classroom with us. To understand this a little bit better, let's take a look at sports and the concept of an uneven playing field and why performance-enhancing drugs might be banned there. Ethicist Sigmund Lowland, who's a professor of sport philosophy in Norway, talks about why sports feel the way they do about performance-enhancing drugs. First is that an ethic of a sport is to strive for a level playing field. Now, this isn't just about fairness. If it was, then you'd just allow everybody to use a performance-enhancing drug. There'd be a problem here because the drugs aren't available to everyone and they're expensive and not everyone could afford them, so it wouldn't really be level. However, let's ignore that for a minute and assume that everyone could get it. Then you would have a level playing field. But still, this doesn't seem to be what sports are after. This is because, says that this is because sports aren't merely a spectacle. Sports have rules because they're trying to eliminate the external factors. They're trying to bring the sporting event down to highly trained physical abilities being matched against each other to see what happens. Something similar can be said for education. Education isn't just about getting a test score that's allowed by being able to focus better by taking a drug. Instead, it's about providing robust training and growing knowledge. When you take a drug to enhance your ability to take the test, you're not just hurting yourself with possible biological side effects, but you're making it so that those who have worked hard to achieve things for the test can't really get a fair measure of their strength in academic standing. The second problem can also be understood from a sports analogy. Using these drugs cultivates a climate of cheating. The Race That Shocked the World is a documentary done by the BBC. It looked at the 1998 Olympic Games, where in the 100-meter dash, 6 of the 8 men who were finalists were eventually convicted of doping and had to vacate the times that they ran in the race. It's a huge scandal for sports. When these 6 men were interviewed who did commit the doping, they all had the similar reply. They said, if you wanted to win, you had to do it. Everyone else was doing it. The other 2 who weren't taking it admitted that they knew they didn't have much of a chance in the race. They weren't taking the drugs, and they knew by not taking them, there wasn't really much of a shot for them to win. So what we see here is, when it's cultivated in sport, is that if you have the perception that everyone else is doing it, it pressures those who don't want to use the drugs to use it themselves, and you have a snowball effect. You might wonder if this actually happens in education. Well, there's some evidence that it does. The national average for uses of stimulants is about 20%, but if you look at specific studies, such as one done at the University of Kentucky, you can find that 50% of their students have admitted to using the drugs. So it does seem that the people who are around and you're competing against and your perception of whether or not they're using them can cause a problem. So you can contribute to both this unlevel playing field and emphasizing the wrong part of the metric of testing and education, and to force your peers to use things that they don't really want to in order to succeed. It's not a healthy environment for learning. Neurobiologist David Anderson of Caltech talks about why these drugs have the effects that they do on our brains. We need to realize, he says, that our brains are more than just a bag of chemicals. They're very complex entities that we don't understand very well. It's very hard to pinpoint exactly what area of the brain needs to be targeted when we administer a drug. Stimulants act over the whole thing, not just in part that it's needed. He draws an analogy to changing the oil in a car. said that taking a drug for a mental disease is kind of like opening up the hood of your car, taking oil, and pouring it all over the engine block, just hoping that some of it will dribble into the right place. That's going to do a lot more harm than good to your engine. In the same way, you can do a lot of harm to your brain by taking these drugs when you don't really need them. If you look at the side of a bottle of Ritalin, you'll see a list of side effects. It might say something like this. This may cause loss of sleep, elevated blood pressure, chest pain, shortness of breath, dizziness, skin rashes, anxiety, psychosis, and periods of mania and schizophrenia. However, a lot of people won't expect to see those things happen to them. But what you can expect to see is the later three is another problem. Adaptation, and then what follows, dependence. Alan Shroop, a professor of psychology at the University of Minnesota's Institute for Child Development, talks about the adaptation that occurs. He said that there's no studies that show any long-term benefit from taking the drugs that cause stimulation, even in children in ADHD who need them. At first, the studies show that the medication produced some good result within about a year, but by the time you get 3 years out, the effect has faded. 8 years out, and there's no evidence that the medication did anything to help at all. In fact, the children are worse off. Why would this be? Well, the body is able to adapt. It doesn't respond to the drug anymore because it's there all the time. It gets used to it being there. This then leads also to a dependence. Because your body is used to the drug being there and not producing it on its own, you're not able to function normally. So if you come off of the drug, you're going to have set periods of withdrawal. In order to maintain even a normal level of function, you need to keep taking the drug. As one student told NPR about her use of Adderall, the more you use it, the more you want to use more of it. The final problem that occurs is psychotic disorders. Dr. Jeff Benson talks in a editorial letter to students warning them about these drugs that about 10% of children who take ADHD medications develop a mental psychosis. Now, it's not entirely clear how much of this was contributed by the drugs, but it is higher than the normal ADHD population. So these four do give us some grave areas of concern about how pouring these drugs over our brain can affect its function.